Welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. And it's been a while since we have sat down with our favorite doctor, Dr. Anu Seshadri. Good to see you, Doc.
Good to see you as well.
First of all, how are you holding up in the trenches there? Who would have thought we'd still be doing this whole COVID thing 5 months later?
I know, right? I don't even know where, is it summer? Is that what it is right now? So I guess that answers your question. I'm just taking it day by day and just doing what I signed up to do.
Well, and we appreciate you for that. Speaking of answering questions, I thought we'd do a little one-on-one. We've got some viewer questions. Are you down to answer some burning questions from our viewers?
Bring it.
All right, here we go. Question number one. This comes from Scott in Steamboat Springs. The question is, and this is relevant, this is one I've asked you offline, is it true that there is an antiretroviral shortage brought on by shipping and costs due to the COVID-related barriers?
It is actually true, and I will state this, as far as what I know, is that the UN AIDS has actually gotten involved and has reached out to various countries, because it's not just the United States, but it's, at least 73 different countries have been identified that they are experiencing a shortage. And, they're really putting it out there. The UN is really putting it out there that government needs to be aware of this situation and take the precautions that it needs to in order to make these medications available.
Well, what's your advice then for someone like me living with HIV? Is there a real chance that in the United States I could run out of my meds in 2 months?
I can't speak for the future, but what I would say is, especially given COVID right now, I've been encouraging my patients, and me myself, when I do prescribe to patients, I'm prescribing them a 3-month refill, or even a 6-month refill or prescription, so that you have enough for at least the time being, 3 months, 6 months.
Okay, well, thank you for answering that. Next one, question from Jamie in Providence. Jamie asks, why did officials originally say masks were not effective? Now they're telling everyone to wear them. This mask thing goes on and on and on. Personally, I don't get it. Just put on the mask. It's not that difficult. But Jamie has a point. We were told in the beginning, don't really need to worry about the mask.
Right. And it's because with new data and with new evidence, we're going to have to change policies. This is a novel coronavirus. I think I've said this before. This is a brand new virus that we're still investigating, that we're still studying. So as we learn more about it, such as what we can do to protect ourselves, we're obviously going to change our public health policies dealing with this virus. So before, yes, it was shown that it can be spread through respiratory droplets. You don't necessarily need to wear your face mask. You can just be socially distant. But then they were noticing that it was through studies again that this was noticed that there's a bunch of asymptomatic carriers. What that means is that there are certain people that do not have and show symptoms of a runny nose, cough, diarrhea, etc., but they are still infective and spreading it. And in order to stop that, then we, just like shown in other countries where this was implemented, such as Japan and China, where they were universally masking, the spread decreased.
Right. Well, keeping on the topic of masks, Kai in Torrance here in California has this question for you, Dr. Anu. The question is, if I'm outside exercising or walking and away from people, do I need to wear a mask? People eating at restaurants are not wearing them outside. That's a really interesting point, because we can sit down and we can eat outside now here in California, and you can take your mask off. What's the difference between that in a restaurant with people 6 feet apart and me working out outside?
I'm going to say this. If you're working outside and there's no one near you, or at least you are guaranteed 6 foot distance, right? 6 to 9 feet, 6 foot distance, then you don't necessarily have to wear it. But here's also where county regulations come into play. And unfortunately, now it's become a regulation, right? Certain places, if you are seen without a face mask, then you are fined. And that's what it comes down to. Do I agree that you don't necessarily have to wear a face mask if you're not around people and you're socially distancing, and yes, you're exercising on your own? Yes. So that's my answer for that question.
All right. Yeah. Well, it's certainly a hot debate. Another hot debate that's really ramping up right now is about education. So we've got another question here. This question is from Evan in Brooklyn. Evan wants to know, is it safe to send my kids to school? And if so, why? Boy, this one's tricky because you hear Fauci saying certain things. The president is saying what he wants to say. But from a medical standpoint, as someone who is, and you look after kids, what is your take on this?
I'm gonna tell you what a couple of trusted sources have said, and then I'm gonna also tell you what I think personally as well. So according to the American Academy of Pediatrics, as well as the CDC, they are recommending children to go back to school because one of the concerns that these institutions have, as well as parents are having, is social development and the increase as well in mental health issues that have come up because of COVID and staying at home, lack of coping skills, lack of interaction, I guess, with their friends, as well as one-to-one interaction with teachers and students. And that is a real concern. And so this is why the CDC and the AAP have given strict criteria that schools should implement in order to try to mitigate or to try and decrease the spread of COVID-19 within a school environment and making it safe both for teachers, staff, as well as students. So it really depends on how well the school is following county guidelines, as well as the CDC, as well as the AAP guidelines. I would say, me personally, as a pediatrician, it's really tricky because you do hear about kids being carriers and being asymptomatic, like we talked about. A majority of these asymptomatic carriers are younger individuals. So the screening measures that you talk about when it's implemented in schools, is it really effective? It may not be. And then there's a lot of trust that's being placed on families as well as the parents to truly report if someone is sick at home or if the child is sick. And having that open communication and efficient and effective communication between the school and the families. So my advice in general that I've given is parents really need to have an open discourse with their school, understand what the CDC and the AAP and the county regulations are asking of schools to do, and see if their schools are implementing it, and have a talk with the school officials to get all your questions answered. And of course, come talk to us to get your questions answered as well.
Yeah. And, I mean, it just goes to show it's hard to have a right answer on any of these questions because there are still so many unknowns about this virus. We've got about a minute left. So last question, this is from Sherry in Woodland Hills, wants to know, should I get tested even if I don't have symptoms?
And the answer is, you don't really have to get tested if you don't have symptoms, but if you are concerned, let's say that you are visiting your grandfather that is 88 years old and considered to be high risk, if you want to get tested so that you are safe in order to see him, then you can consider to do so. But the pre-test probability, meaning the reliability of testing if you don't have symptoms, is not that great. So that's something to consider. But I would say it really depends on your own situation and your own health.
Right. If you're hanging out at home and still doing the physical distancing and you're by yourself and you're not displaying symptoms, perhaps not. If you're going to be out and put someone who may be at risk, and it's unavoidable, might be worth checking out. That is all the time we have. Anu, I love chatting to you. Thanks for taking the time out of your busy schedule. It's always a pleasure to see you.
It's always a pleasure to see you too, Karl.
That's going to do it for this episode of Plus Talk on Plus Life. For any more information on what we've covered today, be sure to check out the website, pluslifemedia.com. And remember, you can follow us across social media at Plus Life Media. Until next time, remember, live your best life. Turn positive into a plus. We'll see you next time.